Hello and welcome. Sorry about that. Today, we're talking about pediatric dentistry. Let me start off by saying there is a special place in heaven for every single pediatric dentist on the planet. It is arguably one of the most stressful jobs in dentistry, yet it can be one of the most fulfilling. But if you have no idea what you're up against, and you truly won't understand unless you've treated a decent amount of crying kids. So yes, Peds is a field of dentistry that holds a very special place in my heart, and also makes me really grateful for the specialists that I refer to. If you don't know, pediatric dentists specialize in dental care for infants, children, adolescents, and individuals with special needs. Their focus extends beyond just treating dental issues. They prioritize creating positive experiences to foster a lifetime of good oral health habits. Far too many times, I see adult patients that could have saved a lot of time, pain, and money simply had they had better pediatric care growing up. So in this video, I want to talk about the life of a pediatric dentist, the potential salary, what they're doing on a day-to-day basis, and the path to pediatric residency. And if you stick to the end of the video, you'll hear my unfiltered opinion on if I think it's an amazing profession or one that just leads to an absolutely miserable life full of the sound of crying kids all day. All right, let's get right into it. Guys, dentistry is a profession. We're here to make money. I'm Dr. Cash, and I'm here to create healthy conversations about income as a dentist, since nobody on the internet wants to talk about this stuff with the insanely high debts these days. So let's start off by talking about the elephant in the room. Is the salary for a pediatric dentist high enough to pay down your debts and live a comfortable lifestyle instead of choosing regular old general dentistry? When we compare the average salary for a pediatric dentist versus general dentist, the disparity is notable. According to the ADA, the average annual salary for general dentists was around $175K, while pediatric dentists earn significantly more, with an average of $304,000 per year. ZipRecruiter has the average at $277,000 a year. That's a substantial difference, showcasing the financial potential within pediatric dentistry. Like, wow. Talk about an amazing salary, well into the top 5% earners of America. Sounds like a pretty good option if you're just drowning in debt, if you ask me. It's a more guaranteed way to a higher salary, unlike those crappy general dentist jobs that are much lower paying. These numbers will vary per location and per office, but I've never met a struggling pediatric dentist financially. Actually, most skew on the higher end of the salary range. Now let's run through a typical pediatric dentist day. Here are the types of procedures commonly performed by pediatric dentists. 1. Infant oral exams. Pediatric dentists conduct thorough examinations of infants' mouths to assess oral development, identify abnormalities, and provide guidance on oral hygiene practices for parents. Those primary and mixed dentition eruption patterns still drive me crazy to this day to memorize. It always takes me a little bit longer when I see the x-rays like this. So shout out to those pediatric dentists for having that information on lock. 2. Peds are also conducting preventative care, such as dental cleanings, fluoride treatments, and the application of dental sealants to protect children's teeth from decay. 3. Restorative dentistry is also done. In addition to composite fillings, pediatric dentists are doing stainless steel crowns. They're doing pulp therapy like pulpotomy or pulpectomies to save inflamed tissue in primary teeth. Also, extractions of primary teeth are done on severely decayed teeth or teeth that would cause issues with the eruption of permanent teeth. Orthodontic evaluations, such as misaligned teeth or bite problems, are carried out and sometimes are also referred out to the orthodontist for further treatment. Lastly, sedation dentistry for phobic and anxious kids. And trust me, there's a never-ending supply of phobic children because everybody makes it seem like the dentist's office is a terrifying place to be. For example, my brother is an optometrist, and I always joke around with him saying his job is so boring and he's just a glorified eyeglass salesman. But then whenever he sees a crying kid, he just tells them to cheer up because at least you're not at the dentist's office. Like, bro, come on, I'm gonna have to see that extra frightened child one day because of you. Not cool. Anyways, pediatric sedation includes nitrous oxide, which is laughing gas, oral sedatives, or deeper sedation protocols to help uncooperative children relax during dental procedures. Also, a really challenging aspect of Peds is dealing with kids with special needs. I've worked in some of these special needs rotations in dental school, and man, that was absolutely heartbreaking work. It's really difficult to help special needs children. It's very rewarding after completion of treatment, but it takes a toll on you mentally. Many times they will have the child more deeply sedated in the operating room of a hospital to better manage the cases. It's really difficult stuff to deal with if you're just looking for a comfortable job and a nice lifestyle. And it's these types of cases that I definitely could never see myself doing. But if you see yourself doing any of the listed procedures I mentioned on a daily basis, Pediatrics offers an amazing work-life balance and a salary to reward you for your efforts. On average, pediatric dentists work fewer days compared to general dentists, while also making more money. This means that they have more time for themselves and for their families without sacrificing financial stability. But surely a baby tooth extraction cannot pay you that much more than a regular tooth extraction, right? How are pediatric dentists generating such high profits? You see, my friends, it's the volume of patients and the efficiency at which these procedures are completed that drives earnings in this field. You see, it's rarely single tooth dentistry in Peds offices, so a lot of the cases come with multiple procedures being performed at once. They don't really operate on specialty codes like other specialists. Some insurance companies don't even classify pediatric dentists as specialists, and they aren't getting higher fees for the same general dentistry procedures. Instead, they do much more of a very few select types of procedures. And those procedures are often simple and quick. Think about where the money of a pediatric patient is coming from. It's their parents. We all know that most parents would prioritize their child's health over their own. I've seen parents with rampant perio disease showing up to my office for their kids' ortho appointments. So just know that you have a stable paying demographic for those procedures too. Let's break it down a little further. Consider a typical patient for a pediatric dentist. For instance, let's say they perform 2 fillings, a stainless steel crown, some fluoride varnish, and an extraction on a pediatric patient. All of these procedures take just a few minutes to do because the teeth are so freaking tiny. A little zip, zip with the burr for a stainless steel crown to break the contacts, and you're done. I've extracted baby teeth with gauze before. A simple little swipe down, and the tooth comes out. And those baby teeth are literally the cutest things ever. And there's never really many complications that come with these types of procedures. You're not doing a second molar endo or having to drill an implant and pour D4 quality bone within the posterior maxilla with the pneumatized sinus. Instead, it's all relatively chill stuff. Now, let's imagine the average pediatric dentist sees an average of 30 to 50 patients per day. And it's not unusual to go over 50 a day, by the way. With each patient requiring various treatments similar to the examples mentioned, it's quite evident how the volume of patients and procedures quickly add up, resulting in a substantial income for the pediatric dentist. But holy crap, talk about stressful. What I've seen help these doctors is their training in behavior management. Pediatric dentists employ a variety of behavior management techniques, such as positive reinforcement, distraction, and tell, show, do, to help children feel more comfortable and cooperative during dental visits. This is really what separates them from a regular general dentist. Because even though I love kids, at times it's very challenging to get them to be still in the chair, and at times I have to refer out, not because of the dentistry, but because of the patient management. All right, so what's the route to becoming a pediatric dentist? Okay, don't take this the wrong way, but I don't think pediatric dentistry is quite competitive to get into because not as many people want to do it from the general dentist population. I think your grades have to be somewhat average. You don't need to be at the top of your class or really have an outstanding application. Listen, I'm sure if you're trying to get into your top program in the dream city you want to live, it can be quite tricky to maneuver. But overall, I think shadowing in the clinic, showing intention, getting good recommendation letters from your pediatric professors, all would really help you have a good application for pediatric dentistry. I think it's much more about showing up than being extremely good academically. All I'm saying is just try your best in school, and if your passion for peds is there, the admissions committee will pick up on it immediately, and I'm sure you'll get in. As promised, if you stuck around, I want to open up a bit and be a little more serious about the potential about pursuing pediatric dentistry. Before considering becoming a pediatric dentist, it's important to know if you have what it takes for this job. You see, money shouldn't be a motivating factor, as this career is deeply rooted in compassion, patience, and resilience. With pediatric dentists often seeing anywhere between 30 to 50 children every day. If you're not suited to handle such emotionally taxing situations, this profession has the potential to destroy you internally. Yes, you may love working with kids, I get it, but you will see the worst of what a pediatric population may look like at times. This is similar to what my veterinarian friends say. They say they love animals, that's why they chose to be a vet. But now they spend lots of time dealing with animals in pain due to the neglect of their owners. You see, these kids all have pure souls and simply don't know any better about the situations that they're in. Bad parenting can really bring about some sad times in the clinic, and I've heard horror stories of pediatric docs doing full mouth extractions on kids, and those stories really break my heart. So speaking from personal experience, even though I have a genuine love for interacting with children, I must admit that I am not cut out to be a pediatric dentist. Working with kids is so special to me because it allows me to bring out my inner child again, which I think we all keep inside. And at times, I feel that society tries to quiet this part of me. But with Peds, everything becomes fun and playful again. I treat Peds almost like a game, where I have to get this kid to befriend me by bringing up things that are relevant to them, so I can create a positive association with the dentist's office, hopefully having a long-lasting impact on them. Despite all of this, I'll say that the hardest procedure I've ever performed in my life up until this point was an occlusal filling on tooth K on a 6-year-old girl in dental school. Call me crazy, not joking. Trying to numb her was like throwing a dart on a moving target. I was like chasing her head around with the drill just to get a few seconds of burr contact with the tooth. It was awful. Even the resident showed me a technique where they're pretty much like putting the child in like a headlock, right? So kind of getting them nice and straight just so they can get them some anesthesia and open their mouth up. And it was like an eye-opening experience. Like, it wasn't that aggressive, but like, it was like, whoa, holy shit. But enough about wrestling with pediatric patients. In wrapping up this video, I want to express why I believe pediatric dentistry is an extraordinary profession that's definitely worth considering. I hold a deep admiration for my pediatric dentist colleagues, as I find their work incredibly fulfilling. Not only does pediatric dentistry offer ample opportunities financially, but it also provides an excellent work-life balance from my perspective. Additionally, the path to specializing in pediatric dentistry is manageable, making it an accessible option for those who are passionate about working with children. In my view, pediatric dentistry, alongside oral surgery, stands as one of the most in-demand specialties that will always have a vital role in the dental field. The demand for pediatric dentists remains consistently high. Dental caries is the leading childhood disease worldwide, and consumption of sugary foods is clearly on the rise. Despite the rise of oral healthcare awareness, they somehow keep making those Oreos and Nerds ropes tasting better and better every single year. Sometimes even I can't help myself. So the need for pediatric dental care remains. If you're watching this video, I encourage you to hit that like button if you found this content valuable and wish to see more like it. I welcome your thoughts and feedback in the comments on what brings you towards the field. Best wishes to you all. I look forward to connecting with you further. Until next time, this is Dr. Rana signing off.